Hi, folks. Brad Heineck, physical therapist.
Hi, I'm Chris the Pharmacist.
And today we're going to discuss heart attacks, early signs and symptoms. We're going to discuss some treatment as well as some variations between male and female symptoms. So stay tuned, and Chris is going to give you everything you're going to need to know.
Bob and Brad, the two most famous physical therapists on the internet.
All right, so heart attacks, guys. That's really the United States and pretty much worldwide the #1 killer for both males and females. And when
Wow.
we have a heart attack, it's not like what we see in the movies where it's like, oh my God, I'm having a heart attack, get help. It's not like that. And I mean, sometimes they are. I mean, 90% of people are going to present with massive crushing chest pain and shortness of breath. Those are the top two symptoms of a heart attack.
Okay.
But there's, subtle differences. There's differences between men and women to a degree, and we'll kind of dive into that a little bit as well. But the symptoms of a heart attack oftentimes ramp up gently or quietly before we actually have the actual heart attack.
So you mean over a period of a day, weeks, or?
Days, weeks, I mean, up to 3 to 4 weeks, particularly in women. So we'll touch on that a little
Okay.
bit in a little while. But men can have that too. So it's not exactly the same. But what can happen is we have little tiny vessels. And basically, the definition of a heart attack is basically there's an occlusion, blood flow is stopped, it doesn't feed the heart muscle, and it causes damage. So time is muscle in the world of a cardiologist. So
Something gets in the vessel, blocks
Yep.
it like a dam, and there you go. You have
exactly.
no
So it's
blood.
basically a plaque or just a little bit of fat or junk that's kind of goo that's kind of hiding around in the arteries, and it plugs it up, and it doesn't give the oxygen and rich nutrients to the heart muscle itself.
Sure.
And the longer that that's occluded, the more damage is done to the heart, and obviously to the end point can be death. So time is of the essence to recognize these symptoms, and sometimes it's a little bit more simple, and sometimes it's a little bit more complex.
Sure.
Overwhelmingly, males and females present with the heart, like I said, the overwhelming chest pain. It almost feels like an elephant sitting on your chest and squeezing. You have difficulty breathing. And this is where it kind of starts to break down between men and women. Women may have, things that led up to this. So for the last month, they just kind of feel fatigued. Man, I'm doing laundry, or a guy can be doing laundry too. It doesn't matter. But like when they're just doing normal household tasks that they do day to day, all of a sudden they're just, man, I got to take a nap. I am just wiped out.
Sure.
Things that just shouldn't crash you, from that standpoint. And then they just kind of think, well, I've been busy at work. I've been chasing the kids around all day, just lots of running and gunning. Maybe
Yep.
it's just a little stress, a little anxiety. And so they kind of bypass that fatigue. And, they might have a little bit of chest pain, but then all of a sudden it seems like, well, maybe it was some indigestion. So they delay time to care. And so the problem is if you feel something, you want to say something. So how do we delineate between, is it a little bit of heartburn? I mean, I don't want to run to the doctor every 5 minutes and think I have a heart attack. But at the same time, you don't want to ignore very serious symptoms.
Right.
And that's one of the things that's very crucial. So, I mean,
Well, I want to get back because you said women may experience that more often, but men don't, or they do not as.
not as often. Usually for men, it just seems like it's the chest pain, which if they don't, they think it's a pulled muscle in their chest in a lot of cases, like they're working out or they did some yard work.
Yeah.
And all of a sudden they're just like, man, I just don't feel right. I just can't catch my breath. And all of a sudden, but then they're going to be sweaty and kind of that clammy, that flop sweat where you just,
Women don't.
oh yeah, no, they do too.
Okay.
So it's no, and so that's men and women have the same experiences, but women, when they present with a heart attack, in a lot of cases, describe more symptoms and in more detail than men. Men, it's pretty simple for whatever reason, and I don't know if it's because it was often thought of as a male-dominant disease, which is 100% wrong. For males and females, it's #1 for both of us on the death list. So and it's over time it's become recognized better. But the interesting thing is we're talking about the ramping up. So you can get some of that fatigue, shortness of breath, sometimes pain that radiates down the arm up into the neck and jaw, which
Sure.
seem like traditional things, but sometimes people just blow it off to, I pulled a muscle in my neck. So one thing that people can do if they're experiencing something, if you did have a pulled muscle, usually if you do a little stretch, it's going to go away. So if it doesn't go away, it consistently is there or gets worse, that is definitely the time to probably looking at 911.
And oftentimes that feeling will come with increased activity.
Yeah, and that's the other thing I was going to touch on. So it's one thing. So if you're, your chest has been hurting you when you're sitting down, you're like, I'm just going to get a glass of water and see if something helps.
Sure.
And if you get up and upon exertion, that chest pain is getting worse. That's also another critical sign that probably something more dangerous is going on with the heart itself. So it doesn't matter if it's more neck pain, more back pain, more pain down your arm. So these are things, or even the right arm, which is interesting because usually we think our heart's on the left side of the body. If we have right-sided pain, that's kind of strange.
Sure.
Or even the right side of your back. So women will present and be more descriptive of all those subtler symptoms, which is not, the big two, which is the chest pain and shortness of breath. So that's kind of where it kind of differs a little bit. Some of that may be due to women having a slightly smaller heart, a little bit faster heart rate, and also the smaller blood vessels. And those smaller blood vessels may be what leads to more of the subtler symptoms like the pain down the arm, the neck, or in the back, or even the nausea or indigestion kind of symptoms.
Sure.
So for whatever reason, even though guys can equally have those in a lot of cases, but it just seems like it's more present and more descriptive. Like women will present and tell you at least 3 different symptoms or more, whereas men will just tell you 2.
Okay.
And so from that, and you've got the most skilled nurses and doctors, helping you right away to try and get through all this. And they go through a litany of things when people are having a heart attack, and they have very specific protocols for that as far as how they, because circulation is everything. So, I mean, that's the thing. And so we want to make sure that the sooner that they can get that clog fixed, the sooner you're going to recover and get back to healthy.
So if someone's having these symptoms and they're thinking, maybe I should go in.
Yep.
What are you going to do? Jump in the car and drive? Call 911? Or,
we would recommend calling 911 if it's possible.
Right.
If you are in the middle, you live in a little farm community and the closest hospital is an hour away, it's kind of a crapshoot. Most doctors and legal experts are going to tell you call the ambulance because the ambulance can provide the care that you need along route.
Right.
And if you're having a heart attack, and there's no saying when it's really going to turn bad, like if it just all of a sudden you just have like asystole or something where your heart stops beating, and you're in a car, now you've crashed the car, crashed into another set of people. So, I mean, if you can avoid driving yourself to the hospital at all costs, that is most ideal.
Right.
Number 1 would be 911. The paramedics on those crews that's their bread and butter.
Right.
They know all about how to treat you, get things going, stabilize you as much as they can, so that when you get to the hospitals, the doctors can go work right away.
Right. And they're communicating, so
they're communicating as they go.
Yes.
So yeah, it's a very involved and it's quite intricate but incredible teamwork.
Sure. Right.
So for the survival chain, so it's pretty impressive.
Now I don't know if I wanted you mention this, but you talked about you can self-treat a little bit by taking an aspirin.
Yeah.
Or is that...
So if appropriate, I think it would be okay to chew, and you want to chew an aspirin. So you don't want the enteric-coated aspirin at this point. You want the plain old white tablets.
Yep.
And if you're not on a blood thinner and you don't have an aspirin allergy, we would recommend chewing 1 aspirin, just one 325 milligram aspirin. Basically, it takes 5 minutes to get into the system and start helping to improve blood flow. So that 5 minutes can make a difference in your life or a loved one's
So you're
life.
saying you feel the pain, you're concerned it's a heart attack, you call 911,
Yep.
and then...
Yeah, and oftentimes the operators are very skilled to kind of listen for things. They may actually go ahead and tell you to chew an aspirin.
All right.
So, and it's one thing. And if all you got in the house is enteric-coated aspirin, still chew it. I mean, you're still eventually going to get enteric-coated. So, like a lot of times they're orange in color.
Oh.
And the coating is designed to protect your stomach from stomach ulceration. So it dissolves in your intestines, and then it absorbs.
So you can't chew those?
You can. It's just harder to chew.
Okay.
And it can be kind of hard on the teeth. But
Sure.
But at the end of the day, I think that's the most important thing. But, so when it comes down to it, so what do? We want to recognize the symptoms. We want to make sure if it's not getting better, and I mean, you got time. The other unusual thing with women to men, it seems like they take 37 minutes longer to report a heart attack than men for some strange reason. Oftentimes it may be that the psychology just says, well, it's not happening to me. I'm too busy for this. I've got so many other things going on. I got to take care of the kids. I got to get the grandkids. I got to pick them up at school, and they're just thinking about all sorts of other things.
Higher pain tolerance?
Much higher pain tolerance too, I think. And I think that there's not a lot of clear studies that suggest that, but you will hear anecdotally doctors will say, I just think women are just tougher, and so they just kind of they just kind of attribute to, oh, I'll sleep it off, or I'll walk it off, or
Yeah.
so to speak, rub some dirt on it, and it's just going to go away.
Well, I think most physical therapists deal with a lot of pain with treatment, particularly total knees.
Yep.
'Cause that's one thing you do try to get pain with. And it, hands down, I'm working with a woman. I can push her harder than I can any man
Yep.
with a total knee.
Well-
So whatever, if that's
No, I think
anecdotal.
they are. I don't think there's anything about it. I think anybody will tell you that women are tougher than men. I don't care what you say. I just they have kids. We don't. I mean, it's a pretty simple argument from that sense. But all kidding aside, when we're talking about this, I mean, if it just doesn't seem like it's getting better, if it seems like the pain is getting worse upon just taking a simple walk across the room, I mean, it's 911 time. It's something that I can't stress enough. Some people well, I don't want to go because I don't want to waste their time. I don't want to be embarrassed if it's just like a stupid case of anxiety. Those are all wrong.
Yeah.
I mean, let the pros search it out. They are highly trained. They are expert medical personnel. They will do what they can to sort out what may not be real
Sure.
versus what is devastatingly
Right.
real. And that's
Right.
the one thing that we want to stress more than anything else, guys.
And both Chris and I have been to the ER
Oh, yeah.
with heart attack symptoms,
Yep.
and they weren't heart attacks, but we were both glad we went because you
Oh, yeah.
feel so much better. It's like, okay, now, and then you try and figure out what the problem was, and we both
Absolutely.
did,
Yeah.
and it's just, it's a good thing.
I mean, at the end of the day, I mean, and it's just kind of like whew, at least it's not that. You can always deal with a muscle pull.
Right.
So, and that, or anxiety. I mean, it's something that, maybe that's not simple, and that's not to belittle anxiety and
Right,
stretch the
right.
imagination, but because the symptoms feel the same. And so that's the thing that's hard. So, and we just can't, as human beings that are not trained in medical profession,
Sure.
really recognize, well, is it just indigestion? Is it just a pulled muscle in my shoulder, neck, or arm, or jaw?
Sure.
I mean, it's just too hard to tell.
Yeah.
Let the pros know. They're going to help you. I
Right.
think that's the most important takeaway.
All right, so there you go. Heart attacks, symptoms, signs. Don't mess around with it. I thought the aspirin
Yep.
was something I didn't know about, but I think a lot of medical professionals.
No, absolutely. I
of it.
mean, yeah, it is. I mean, aspirin is important because it helps. I mean, flow is everything when it comes to circulation.
Right.
And so it just thins the blood just a little
Yep.
bit, and that just 5 minutes of getting that in your system and swallowing it takes about 12 minutes. So that's why you want to chew it.
Oh,
So that's important.
Wash it down with
Yeah,
water.
well, you want to chew it, just chew it and swallow.
Oh.
I mean, because actually you really don't want to drink a lot of water because you could regurgitate. So that's
Oh.
an ER. Yeah. So if you can just chew it and swallow it, that's best.
Sure.
And I guess really we'd be remiss if we didn't talk about prevention. I mean, obviously there's risk factors across the board, whether it's, age, genetics, smoking, not smoking, drinking, not drinking. So any of the things, so eating well and getting exercise are two of the biggest things that you can do. I mean, sometimes you can't outrun genetics, but you can certainly
Right,
do things to change the table.
And I think everyone's knows smoking is a
Yep.
big no-no.
That's a big no-no, but it's just something too. I mean, if it's something that you're on the fence on, if you have the ability to try and quit smoking, please do. Just make sure you get out there and walk. Try and stay active. Do active things. Even though it doesn't seem like maybe it's an exercise program, taking a walk every day is a perfect thing to do to help protect that heart.
Right. All right, very good. Enjoy the day and stay healthy.
Thanks, guys.
All right, Chris, today we do have a giveaway going on. It is
Nice.
our knee glide.
Excellent.
Excellent for after surgeries, total knee replacement, meniscus, other surgeries to get that knee moving. Okay, Chris, one of the great things about the knee glide is you can use it in bed right after surgery to get
Nice.
that knee moving. Really is handy. Chris, this is the other great benefit. You can use it on the chair, on the level. You can use your other leg to get the knee to bend more with resistance.
Okay.
Put the stand up. You can work this direction for quadriceps strengthening, added resistance, or even better, hamstring strengthening, moving it that way. And it's very light. It only weighs 3.1 pounds. And I think you know some people that had success with
Yeah,
this.
I've had a couple of friends and customers that we've recommended to from work, so come online, and it works fantastic.
There you go. There's a knee glide. Sign up at bobandbrad.com. Go to the giveaway section, fill out the information, and you could win one.